Good evening, everyone, and thank you for joining us. This is the Mental Health Wellbeing webinar hosted by Black Country Healthcare NHS Foundation Trust, Equality and Diversity team, and also near Neighbours as well, transforming communities together. So today's event is about raising awareness on the issue of mental health awareness and also mental health well-being across all different faith groups, and also to try and kind of break down barriers around mental health and how to look after yourself as well, and also promoting community cohesion and enhancing community confidence as well, and to also explore working differently, how to bring communities together and faith groups together to improve the mental health of local communities and local residents as well. So my name is Mohammed Yasin. My role is Community Development Worker for the Black Country Healthcare NHS Foundation Trust, which is led by Mohammed Yasser, who is the Equality and Diversity Lead. So I will hand over to Shaz to introduce herself.
Thank you, Yasin. Hello, everybody. I'm Shaz, and as Yasin mentioned, we partnered together today. I'm from Transforming Communities Together, and I head up the Near Neighbours program across the Black Country. It's a very interesting program. We have two core aims where we focus on social action and social cohesion. We are funded directly by the government. We are a national charity, and it's been great, really great doing some work with the NHS Equality and Diversity team and working together with them to deliver not just mental health and wellbeing, but also raising awareness on the COVID-19 as well.
We will move on to our first speaker. I'd like to welcome Dr. Bhawana Chawda, who is the Associate Medical Director, Consultant General Adult Psychiatrist for the Black Country Healthcare NHS Foundation Trust. Dr. Chawda is a general adult psychiatrist, and she's been trained in the West Midlands and works in Walsall and other areas of the Black Country. She's an associate medical director with additional managerial responsibilities, and also she's the elected staff governor within the trust. Dr. Chawda is also the vice president of the British Indian Psychiatric Association, and she's very passionate about mental health, and she's keen on addressing inequalities and sees herself as a fair person. Outside of her working life, she is busy with family commitments, and she enjoys cooking, housekeeping, and walking. Dr. Chawda, would you like to introduce yourself? And the floor is yours.
Good evening, everybody, and thank you, Mohammed, for asking me to come and talk in this webinar. As Mohammed says, I am a psychiatrist by profession, which means I assess patients referred to me with regards to what their diagnosis is, and I treat them, and I treat adult patients. And with this webinar, I have not prepared any slides, so it's going to be more of an interactive session to allow time for people to ask questions. And there's one particular thing I would say about my video. I just had a filling, so I'm still anesthetized on one half of my face, so I might look a bit funny, so please bear with me. So Mohammed wanted to talk to the group a small intro with regards to what mental well-being is and how that relates to mental health and mental illness. So very, very much in generic, our mental well-being depends upon how we feel, how we think, how we adjust to what life brings to us, because life is, we assume life is fair, and we assume that if we do the right thing, and if we are fair and fine, then life actually brings only that to us. But we all know in real life, there is no relationship to it. We are all trying to be fair people, good people, but then things are thrown at us. And then in addition to that, it's not just what we think and feel, it's our environment where we live. If I would use the concentric circles, like you are a person there, and there are so many things surrounding you. Within you, it's how you are, what's your health like, what sort of chances you are given in life, and what sort of opportunities you have. The next circle could be your family, how things are, your relationship. And the next circle, you can think in your head, you can imagine like friends, families, and things. So everything has a way of affecting you, negatively and positively. And very much when with the pandemic, which seems to carry on, there are so many restrictions that were placed upon us for our safety. So all that can affect our mental well-being. Mental wellness is such an important concept. It defines your in terms of your ability to perform to the best. And when your mental well-being is affected over a period of prolonged period, then it has an impact on your mental health. I'll give you just a very simple example, and bear with me if you think it is too simple, because the participants who are logged in, you all have much experience of mental well-being and mental health. But a simple example would be, if I'm preparing for an exam, I've done my work, I've looked through my syllabus, I've worked on some past papers, but still I'm extremely anxious. So that anxiety is just for that time being. But if the same anxiety, if a person carries on feeling without a reason and a purpose, then you know that it's affecting their mental health. And over a period of time, any difficulties a person experiences for a long time and in a very intense way, then it moves on to become a mental illness. So there are many things we can do for our own well-being, many common things, including me. I also do that. Like, you try to take care of yourself, your physical health. You eat well, you exercise well, you sleep well, you eat and drink in moderation. You try to reduce your smoking, or don't smoke, or don't take recreational drugs. And then the next step would be, I want to connect with people, because human beings are made to sort of interact. There are only like few people who can be hermits, and they can live an isolated life. But most of us, we need connections, we need a feedback, we need a way of linking up with people, we need their support, and we want to be given a chance to be of use and help to others. So we want to receive help, we want to pass back help and our wisdom. And we are learning beings. Like, we just do what we do, and every day we are learning. And if I would say that, like, I went to medical school, and then I became a general doctor, and then I went to learn psychiatry, and then I became a psychiatrist. So that was my career learning. But to me, I became a better student after I became a mother. And then you realize you learn from your children, and it never stops. You're always learning. You're learning from others' experience. Like when I hear Mohammed, Yasin, or whether I hear Shaz, and I hear to other community development workers, and they tell their stories, how they interact with people, how they help. I get inspired, and I think, okay, if they can do it, I can do it. So you're always a learning being. So you learn. The learning could be anything. It doesn't have to be something serious. Learning could be, you learned a new hack as how to clean. You learn a new hack on the Zoom meeting, or you learned a new recipe. So we are always doing different things. That way our brain is well engaged, and we are not allowing ourselves to sort of worry. And with regards to worry, we can never stop worrying. But how do we make our worrying process an effective process? So you write down your worries, you have a mind map, and then you work out action plans and say, okay, I'll handle this way, I'll do this. If this doesn't work, then I'll do something else. So you try to problem solve. And these things which I'm spelling out are things you people do even without thinking in your day-to-day life. It's like second nature, you just do it. But then when sometimes you are under great stress, you think, oh my God, I don't know all this, but you do know. So that's when you connect and support to people who just point out a mirror to you and say, look, you got the abilities, you got the skills, and revisit your skills. So these are the things. And within all these things, our family values, our culture, our religious beliefs, our practices, they all help. They all strengthen the core within you. And that core actually directs you how you want to sort of steer your life. And it's so pivotal that it brings in the important culture aspects and brings in your values that are embedded in you. And you use those values, because when you go to work, or when you are interacting with people, or when you are working with the population, you realize you take your whole self. You're not just taking your targets, or you're not just taking your terms of condition. You take the person with you. And to me, it's so important that you treat each other with understanding, respect, be curious what the other person is doing, treat everybody fairly. Then you're inspiring people along the line of your journey when you come in contact with people, not even realizing you have done it. And a good deed which is sown will actually bring in great dividends. And we all do that with our children, with our neighbors, with our colleagues. So this is a generic view. This is all my view over the years I have collected and it's sort of imbibed in me. So I'll stop there, Mohammed. And if you want to ask me any questions, I'm here throughout the webinar. And much thanks. And I'm much humbled you called me to speak. And thank you.
Really, really appreciate your input into this, and thank you for coming, and some really, really good inspiring words there as well with regards to mental well-being. And I just agree with something that you've just said as well. Sometimes earlier within our day-to-day lives, we can get overwhelmed with what is going around us. We can just forget our own mental well-being. So I think it's really good, like you said as well, sometimes it's just good to take a step back, slowly take a step back, reevaluate yourselves, and kind of, like you said, make a list of some of the things that are affecting your mental well-being. You know, this really, really basic, really simple things that you can do to help yourself, help your own mental well-being in these difficult times. So really, really appreciate your input, Dr. Chawda.
I want to introduce the amazing Rachel Moore next, who's from Transforming Communities Together, and she's our mental health development worker.
Yes, I'm Rachel from Transforming Communities Together. It's wonderful to be here. I'm just going to give you a brief overview about mental health and some basic signposting information and further information. So it's not a training session as such, but more of an overview. To give some insight into different mental health issues. We'll touch on some suicide awareness and supporting those that are struggling, and look at some tools and practices and some signposting. So we often talk about mental and physical health. We're mind, body and spirit, aren't we? And as Dr. Chawda said, we're affected by the social and political and environment around us and our family and friends and culture. So in such a challenging time as a global pandemic, it's no surprise that our health, mental and physical, is going to be affected. So mental health problems are common, but the good news is they can be treated. So 1 in 4 people have a diagnosable mental health problem at any time. And I'm sure that's increased during COVID-19, or we've all moved along a little bit further along that spectrum. Perhaps our health is poorer than it was perhaps 18 months ago. So that kind of affected our sleep, our appetite, our mood, our interactions and our relationships. And that can result in things that we call anxiety or depression or sleep disorders. And it can impact all areas of life. And this additional stress of the pandemic, it's been gradually building over about 18 months. So even if we're perhaps not aware of it, our bodies and brains are more alert. That's very exhausting. Can lead us to feel perhaps like our minds and our brains are impacted, which is called impaired cognitive functioning. But I don't know about you in the heat as well. You know, our brain's a bit slower, not able to perhaps remember things or recall information so well. So it can feel a bit like, you know, being more forgetful. And actually more of us are now being diagnosed with burnout, which used to be quite rare, but that's the average age now is apparently around 31, and it's happening in groups. So whole cohorts in companies are being sent home, recognizing that you know the whole company is being what's called burnt out. So just going to give 2 simple examples of fairly common mental health problems, and just to see if anything rings true with you. So let's talk a little bit about anxiety. As Dr. Chawda said, we can all feel anxious at times, we can feel stressed, that's normal, it's our body's response to what's going on, and it can be helpful. But when does it become a mental health problem? So generally it's if your fears are stronger than usual and if they last for a long time. And that's perhaps something to seek some help about. And if perhaps the reactions are possibly not really in proportion to the situation, perhaps you're avoiding situations that make you feel anxious, perhaps feeling very, very panicky, or perhaps finding it difficult to go out and about and enjoy things that you used to enjoy. That's probably a fairly common experience at the moment. So a simple example for me might have been, you know, am I going to be able to get the right kind of foods that I'm used to being able to get to from the supermarket, from fairly simple, straightforward anxieties through to more general big worries like, am I going to be able to keep my family safe at this time? So that's a couple of examples perhaps about anxiety. And then in depression, again, very common. You may recognize some of these symptoms: lack of energy, perhaps up and down in mood, feeling like you want to harm yourself, perhaps lack of emotion or extra strong emotions, trouble concentrating, and again, not feeling the pleasure that you normally would, and perhaps sleeping too much, sleeping too little, eating too much, or drinking too much alcohol. So we'll have a look at some tips later for how to tackle some of these symptoms. I'm also just going to touch briefly on the sensitive topic of suicide awareness, just so we can all be a little bit informed about that situation. So sadly, there were nearly 6,000 suicides registered in England and Wales in 2019. Research during COVID-19 is still quite early days, but we do know that generally those who die by suicide, only a minority were known to mental health trusts, and many of those were not considered to be high risk. So we do need to continue to be vigilant, to care for each other, to reach out if we need help. So that could be starting a conversation if you're concerned about somebody. A GP can be a good first port of call for advice around treatments and health and accessing mental health services. Mind and Samaritans are great organisations. I'll put some information up at the end about that. We can offer further training around this at Transforming Communities Together. And if you're struggling, or if somebody else is at risk of immediate harm, please call 999 and get immediate help. Reach out to your communities and your faith communities. Don't struggle alone. There is lots of help out there. So again, Dr. Chawda's touched on this with some excellent advice about taking care of yourself and then being better equipped to help others. The 5 ways to well-being we've mentioned: connecting with each other, with nature, with your spiritual tradition, be active, keep moving about, don't just sit at Zoom meetings all day, notice what's going on around you, keep learning, again, you know, those new skills all the time, and give and receive, and stay connected. And then again, touching again on good physical health, eat well, a mix of different foods, avoiding too much fatty foods or caffeine or alcohol, gentle, regular exercise, get that heart going, and that can impact on mood, keep your mood steady, and keep mind and body in a good state of equilibrium. Please drink plenty of water in this hot weather, stay in the shade, keep calm, cool and collected, and keep breathing well and deeply. Helps oxygen to the body and brain, and helps to keep our mood calm as well. And there's lots of research to show just small things, small steps that improve well-being can really protect against mental health problems, and staying connected into community protects against loneliness and isolation, both of which are very, very bad for our health. So we haven't gone through lots of detail about different mental illnesses, but I hope this has given a bit of an overview with some tips. And there are many organisations to offer support. I hope you can see a slide about that, different organisations that the NHS and TCT work with, and TCT are offering a training session in September, and that's open to everybody. Again, it's an hour on Zoom, and please stay in touch with us. Contact me if I can offer you any more information and help, and stay well, stay safe, and let's all keep looking out for each other. Thank you, everybody.
Some great tips there, Rachel. Thank you very much for sharing those with us, and not just looking after yourself, but also supporting others. And both of you, Dr. Chawda and Rachel, you've raised the importance of looking after yourself so we can support others, so we are well equipped to support others. So thank you very much.
But there are other projects, other webinars coming along as well in terms of trying to engage with people, trying to engage with communities. And at least if you can kind of raise the awareness, just talk about some of the issues that are affecting people, I think at least we're we're heading in the right direction. So I just want to say thank you to everyone.
A big thank you to our speakers. Fantastic contributions from our participants. So thank you very much. And please do join us on our next webinar, which will be focused on suicide. So please look out. If you haven't already liked Black Country Near Neighbours Facebook page, please do, because we do post it on there, so you can find out straight away. And we will also email out